Welcome back to the show, everyone. Today we are doing a deep dive on Salmonella.
Oh, Salmonella.
That's right.
The bacteria that is always in the news, it seems like.
It is.
But always for the wrong reasons.
That's true.
But as medical microbiologists, we know there's so much more to this bug than just food poisoning.
Yeah, absolutely.
Yeah.
So much more. So we're going to unpack all of it right here.
All right, let's get into it.
All right. And for this deep dive, our main source material is going to be the book, Principles and Practice of Clinical Bacteriology, which is a great textbook.
Yes, great textbook.
Used by medical microbiologists all over.
Yeah.
So that's who we are targeting with this deep dive today.
Absolutely.
We're going to explore what the organism is all about, how it causes disease, how we diagnose it, what its epidemiology looks like, and how we can prevent and control this bug.
Sounds great.
And, one of the most fascinating things about Salmonella to me is that even though there are over 2,500 different serovars.
Different flavors, if you will.
Right, exactly. They are genetically almost identical.
Yeah, it's incredible.
So why don't you elaborate on that a little bit?
I mean, it really is incredible. So imagine as a microbiologist, decades ago, you're looking at all of these different serovars and you're thinking,
They're all different species.
right, they're totally different. Like discovering that every dog breed from a Chihuahua to a Great Dane is genetically almost the same.
Wow, that is pretty wild.
Yeah.
So why is this genetic similarity across such a diverse range of serovars so intriguing to us as microbiologists?
Well, for one, it just makes you question,
Everything we know.
well, not everything, but our traditional way of classifying bacteria based on their serotypes.
Oh, so
Are we just scratching the surface?
interesting.
If they're so genetically similar, what are those subtle genetic variations that are driving these big differences in disease presentation?
Right. And how does that impact our diagnostics and our outbreak investigations and even our understanding of its evolution?
All of that.
So we're saying that this textbook is outdated then? Principles and Practice of Clinical Bacteriology?
No.
Not at all.
The serotyping system is still so useful in the clinical setting. We need to be able to quickly identify and communicate about specific serovars, especially during outbreaks.
Right.
But understanding the genomic data as well.
Adds another layer.
It adds a layer of complexity to it and reveals those subtle genetic differences that might explain why one serovar is more invasive or resistant to certain antibiotics than another.
So we need both the traditional map
Yeah.
and the new satellite imagery
Exactly.
to truly navigate the world of Salmonella.
It's like having a street map to find your way around a city and then using GPS to pinpoint the exact location you need.
I like that analogy.
Yeah.
So both tools are valuable depending on the goal.
Exactly.
Okay, well, let's shift gears a little bit and talk about how these different serovars cause disease.
Okay.
I'm ready for some action here.
All right, let's do it.
How does Salmonella actually make us sick?
So Salmonella has evolved some incredibly sneaky strategies to invade our bodies and cause trouble.
Lay it on me.
It all starts in the gut. So think of your intestinal wall as this fortress with specialized cells called M cells acting as gatekeepers.
Okay, I'm picturing it.
Their job is to sample what's in the gut and present it to the immune system.
Makes sense.
But Salmonella has found a way to exploit that.
Exploit them? How?
So it uses something called a type 3 secretion system,
Okay.
almost like a microscopic syringe, to inject its own proteins directly into the M cells.
Wow, so it's injecting stuff into our cells.
It is.
What do these proteins do?
So these proteins, or what we call effector proteins, manipulate the host cell's machinery, and they basically trick it into engulfing the bacteria.
So it's like a Trojan horse
Precisely.
at the cellular level.
Exactly.
That's incredible.
And once inside, Salmonella has another trick up its sleeve.
Oh, there's more.
Oh, yeah.
Okay.
So it can actually survive and replicate inside macrophages.
Hold on, macrophages, aren't those the immune cells?
They are.
That are supposed to destroy invaders?
They are, but Salmonella has found a way.
To get in there and be like, hey, I'm just going to hang out.
Not only does it survive, it thrives inside macrophages.
Wow.
So it uses another set of tools that are often encoded on something called Salmonella Pathogenicity Island 2, or SPI2 for short,
Okay.
to manipulate the macrophage's internal environment. So it's almost like being captured by the enemy and then rewiring their security system to make yourself comfortable.
Oh my gosh, that is both brilliant and terrifying.
It is.
But not all Salmonella infections are created equal.
We're right.
We've got the classic food poisoning scenario, and then we've got typhoid fever,
Yeah.
which is a whole other beast.
It is a whole other beast.
But can you explain the difference?
Sure. So non-typhoidal salmonella, which is usually the culprit in those food poisoning outbreaks, focuses its attack primarily on the gut.
Okay.
But Salmonella typhi, the bacteria behind typhoid fever, has a more sinister plan.
Sinister. How does it travel to other parts of the body?
Exactly. Salmonella typhi also starts in the gut, but instead of just causing that local inflammation, it hitches a ride in the bloodstream and spreads to other organs like the liver, the spleen, even the bone marrow.
Wow.
And this systemic spread is what leads to those characteristic high fevers and other severe symptoms of typhoid fever.
So while both types of Salmonella involve invasion, Salmonella typhi is playing a longer, more insidious game.
You could say that it's not just about causing a quick gut reaction. It's about establishing a widespread infection, hiding within the body's own cells and making itself much harder to treat.
So all of this sounds pretty scary, but as medical microbiologists, we need to know how these different infections play out in our patients.
Of course.
So what are the telltale signs that would make us suspect a Salmonella infection? And how do we tell the difference between, say, regular food poisoning and something more serious like typhoid fever?
That's where our clinical detective skills come in. With non-typhoidal salmonella, you're usually looking at those classic food poisoning symptoms,
Right.
diarrhea, abdominal cramps, maybe a fever, but
Right.
the severity can vary so much from a mild tummy ache to, a more serious invasive infection.
And I imagine knowing which specific serovar is involved can help us predict how severe the infection might be.
Absolutely. Some serovars are just known to be more trouble than others.
Oh, really?
Yeah, for example, Salmonella typhimurium and Enterobacteriaceae are more likely to cause invasive disease, especially in vulnerable patients.
And speaking of vulnerable patients, I know that Salmonella infections can be particularly dangerous for people with weakened immune systems,
Right.
like those with HIV.
Unfortunately, that's true.
Yeah.
So for HIV-positive individuals, Salmonella infections can be life-threatening because their immune systems are already struggling, making it much harder to fight off the infection.
So it just adds another layer of complexity to those patients.
Yeah.
Okay, so we got a pretty good picture of non-typhoidal Salmonella, but what about typhoid fever? What should we be looking for in a patient who might have that?
So typhoid fever is a bit of a slow burn. It typically unfolds over a few weeks with different stages marked by, different symptoms.
Interesting.
So it usually starts with this gradually increasing fever, often accompanied by headache fatigue, those kind of vague muscle aches that make you think you're coming down with something.
Right.
And then in the second week, you might start seeing those characteristic rose spots.
Rose spots.
Yeah, there are these faint pink spots that appear on the chest and abdomen.
Wow.
The spleen and liver can become enlarged, and the patient might experience abdominal pain and constipation,
Okay.
or sometimes even diarrhea.
Wait, diarrhea and constipation?
Yeah.
That seems counterintuitive.
Typhoid is full of surprises.
That's true.
And as the infection progresses, things can get pretty serious.
In what way?
So complications like intestinal bleeding or perforation can occur, which can be life-threatening.
So early diagnosis is crucial.
Absolutely.
Yeah.
The sooner we can diagnose typhoid fever and start treatment, the better the chances of a full recovery.
Which brings us to the lab. How do we actually pin down a Salmonella infection? And how do we differentiate between the different serovars?
So it all starts with a good old-fashioned culture.
Of course.
For non-typhoidal Salmonella, we're usually looking at stool cultures, while for typhoid fever, blood cultures are essential.
Makes sense because the bacteria are circulating in the bloodstream.
Exactly.
So it's not just about plating the sample and waiting for something to grow.
Yeah.
What are the tricks of the trade when it comes to Salmonella cultures?
Well, we have to use selective media that inhibit the growth of other bacteria while allowing Salmonella to flourish.
Right.
And sometimes even that's not enough.
Really?
We might need to use enrichment broths to increase the sensitivity of the culture, especially if we're dealing with low numbers of bacteria.
Interesting. And let's not forget that a single negative culture doesn't rule out Salmonella.
Oh, absolutely not. We often need multiple stool samples collected over a few days to increase our chances of catching those sneaky bacteria.
Right, because they can be intermittent shedders.
They can.
So let's say we have a suspicious colony growing on our plates. How do we confirm that it's actually Salmonella? And more importantly, how do we figure out which serovar we're dealing with?
That's where our biochemical and serological testing comes in.
Yeah.
Biochemical tests help us narrow down the possibilities based on the bacteria's metabolic properties.
Okay.
And serological testing uses specific antibodies to detect those unique antigens found on the surface of different Salmonella serovars.
So it's like giving each Salmonella serovar a fingerprint.
Precisely. Each one has a unique combination of antigens allowing us to pinpoint the culprit.
With incredible precision.
Yes.
I love it.
Yeah.
But the world of microbiology is always evolving. So what are some of the newer molecular techniques that are changing the way we diagnose Salmonella infections?
Great question. So molecular techniques like PCR and pulsed field gel electrophoresis, or PFGE, are becoming increasingly important in the diagnosis and tracking of Salmonella.
I can see how they would be.
So PCR allows us to detect specific Salmonella DNA sequences, even in samples with very low bacterial counts.
So that can really speed up the diagnostic process.
It can dramatically speed it up, and it also increases our sensitivity.
And PFGE helps us create those detailed genetic fingerprints of different Salmonella strains, right?
Exactly. PFGE is incredibly useful for outbreak investigations
Really?
because it allows us to track the spread of specific strains from person to person, or even from a contaminated food source to patients.
So it helps us piece together that transmission puzzle.
Exactly like having a microbial CSI team.
I love it.
Yeah.
But I don't want to forget about the classic Weidel test, especially for typhoid fever. Does it still have a place in the modern microbiology lab?
So the Weidel test can still be helpful, particularly in areas where resources are limited.
Okay.
But it does have its limitations.
Such as?
So it detects antibodies against Salmonella typhi in the patient's blood.
Right.
But cross-reactivity with other Salmonella serovars can occur.
So it's not a perfect test.
Not a perfect test.
But we need to interpret those results carefully. Considering things like the patient's travel history and potential exposure to other Salmonella.
Absolutely. It's one piece of the puzzle, but not the whole picture.
Okay, so we've covered the organism, its sneaky invasion strategies, and how we diagnose it in the lab. But what about the bigger picture? How does Salmonella spread in the first place? And what can we do to prevent and control those outbreaks that always seem to be making headlines?
Well, that's where epidemiology comes into play. Understanding the patterns of Salmonella infection, both globally and locally, is crucial for developing effective prevention and control strategies.
It seems like most people associate Salmonella with food poisoning outbreaks. Is that a fair assessment?
You're right. Non-typhoidal Salmonella is a major cause of foodborne illness worldwide.
Yeah.
And the way it gets into our food can be quite complex.
So where does the contamination start?
It can actually happen at any point along the food chain, from the farm to our plates.
Wow, so anywhere.
Yeah, so animals, especially poultry and livestock, can carry Salmonella without showing any signs of illness.
Oh, so they're asymptomatic.
Exactly. So their meat, eggs, even unpasteurized milk can become contaminated during processing or handling.
And then if the food isn't handled or cooked properly, it becomes a breeding ground for Salmonella.
Exactly. That's why food safety practices like thorough hand washing, proper cook temperatures, and avoiding cross-contamination are so crucial for preventing Salmonella infections.
Yeah, it's amazing how such simple practices can make such a big difference.
Absolutely.
It sounds like it's not just about individual responsibility in the kitchen, though. What role does public health play in preventing Salmonella outbreaks?
Public health plays a huge role.
How so?
So surveillance programs track Salmonella cases. They identify common sources of contamination and implement interventions to prevent further spread.
So they're like the detectives of the food world.
Yeah, that's a great way to put it.
Tracking down those outbreaks and figuring out how to stop them.
Exactly. So they investigate outbreaks, trace them back to their source, and take steps to eliminate that contamination.
And sometimes this involves recalling contaminated food products or even temporarily closing down food establishments that aren't meeting those safety standards.
Exactly.
So it sounds like a complex and challenging job, but a very important one.
It is.
Now, typhoid fever presents a different set of challenges when it comes to epidemiology and control, doesn't it?
It does, yes. Typhoid fever is a human-specific disease.
Meaning?
It can only be spread from person to person.
Okay.
This makes it particularly challenging to control in areas with poor sanitation and limited access to clean water.
Yeah, I can see how that would be a problem.
Yeah.
So how do we tackle typhoid fever from a public health perspective?
So improving sanitation and hygiene practices is paramount.
Yeah.
This includes ensuring access to safe drinking water, proper sewage disposal, promoting hand washing.
The basics.
The basics. But they can have a huge impact on reducing transmission.
And I believe we also have vaccines available to protect against typhoid fever.
We do, yes. There are two main types of typhoid vaccines, a live attenuated vaccine and a bicapsular polysaccharide vaccine.
Okay.
And both offer good protection against typhoid fever, although they have different advantages and limitations.
So it sounds like we need a multifaceted approach to effectively control typhoid fever.
Absolutely. It requires a combination of public health measures, individual responsibility, and vaccination efforts to really break that cycle of transmission and protect vulnerable populations.
We've talked a lot about preventing salmonella infections, but what about treating them? What are our options once someone is already sick?
So that's where we shift from prevention to intervention.
Right.
And thankfully, we have a range of antibiotics that are effective against salmonella.
Okay, good.
Yeah.
But I imagine choosing the right antibiotic isn't always straightforward. What factors do we need to consider?
You're right. It's not a one-size-fits-all approach. We need to consider the specific Salmonella serovar involved, the severity of the infection, and increasingly the problem of antibiotic resistance.
Of course. So let's start with non-typhoidal salmonella infections. What are the typical antibiotics used in those cases?
So for uncomplicated cases of salmonellosis, antibiotics often aren't even necessary.
Oh, really?
The body's immune system is usually capable of handling the infection with supportive care, like fluids and rest.
Okay.
But for more severe cases or in patients who are at higher risk of complications, antibiotics are definitely needed.
And what are our go-to antibiotics in those situations?
So fluoroquinolones like ciprofloxacin have been the first-line treatment for many years.
But antibiotic resistance is a growing concern.
Unfortunately, yes, we're seeing increasing resistance to fluoroquinolones in some Salmonella strains, which makes treatment more challenging.
So what are the alternatives when fluoroquinolones aren't effective?
Other antibiotics like azithromycin, ceftriaxone, and trimethoprim sulfamethoxazole can be used depending on the susceptibility pattern of the specific Salmonella strain.
Right. So we need to do susceptibility testing.
Absolutely. Susceptibility testing is so crucial. It helps us choose the most effective antibiotic for the individual patient and minimizes the risk of contributing to further antibiotic resistance.
It sounds like a delicate balancing act. Now, typhoid fever requires a slightly different approach to treatment, doesn't it?
It does, yes. Typhoid fever is generally a more serious infection that often requires hospitalization and intravenous antibiotics.
Okay. Yeah. And historically, chloramphenicol has been the mainstay of typhoid fever treatment.
It was, but its use has declined in recent years due to concerns about toxicity and the emergence of resistance.
So what are the preferred antibiotics for typhoid fever now?
So fluoroquinolones like ciprofloxacin and ofloxacin are now considered the first-line treatment in many parts of the world.
But again, antibiotic resistance is always lurking in the background.
You're right. We're seeing increasing resistance to fluoroquinolones in some Salmonella typhi strains, particularly in certain regions.
What options do we have when fluoroquinolones are no longer effective?
Third-generation cephalosporins like ceftriaxone and cefotaxime can be used,
Okay.
but they often require intravenous administration, which can be challenging in resource-limited settings.
And I've heard that azithromycin is emerging as a promising alternative, especially for children.
Yes, azithromycin has shown good activity against Salmonella typhi, including some multi-drug resistant strains.
Oh, wow.
And it's also available in oral form, making it much easier to administer, particularly to children.
So it seems like the landscape of typhoid fever treatment is constantly evolving as we grapple with the challenges of antibiotic resistance. It's a reminder that we need to stay vigilant and adapt our strategies.
Absolutely. Ongoing surveillance, antimicrobial stewardship, and the development of new treatment strategies are critical for staying ahead of this global threat.
Before we wrap up, I wanted to touch on something I've always found fascinating, those chronic carriers of Salmonella.
Oh, yes.
They can silently spread the bacteria for months or even years after recovering from the acute illness, right?
You're right. Chronic carriers can be a silent source of infection, shedding Salmonella in their stool long after they feel better.
So how do we manage these individuals and prevent them from unknowingly spreading Salmonella?
Identifying and managing chronic carriers is crucial for preventing further spread, especially in high-risk settings like healthcare facilities or food handling establishments.
And can antibiotics eradicate the carrier state?
Prolonged courses of antibiotics can be effective in some cases, but it's not always successful, and we have to weigh the potential benefits against the risks of antibiotic use, including the risk of driving further antibiotic resistance.
So a careful and individualized approach is needed for each chronic carrier.
Absolutely. It requires collaboration between clinicians, public health officials, and the individual carrier to determine the best course of action, taking into account their specific circumstances and the potential risks to public health.
Well, I think we've covered a tremendous amount of ground in this deep dive into Salmonella. It's been an eye-opening journey through the complexities of this surprisingly sophisticated bacterium. What are your key takeaways?
For me, it's a reminder that Salmonella is a constantly evolving threat, from those sneaky invasion strategies to the ever-evolving challenges of antibiotic resistance. It keeps us on our toes. We need to stay informed, adapt our approaches, and collaborate across disciplines to effectively diagnose, treat, and prevent its spread.
Absolutely. And never underestimate the power of good hand washing. But before we sign off, are you ready for a little pop quiz?
Bring it on.
All right, here's the first question. Describe the key differences between Salmonella and E. coli based on their taxonomy and pathogenicity.
Okay, so both Salmonella and E. coli belong to the family Enterobacteriaceae, a large group of gram-negative bacteria found in the intestines of humans and animals. But that's where the similarities end taxonomically. Salmonella is a genus with 2 species, Salmonella enterica and Salmonella bongori, and Salmonella enterica further breaks down into 6 subspecies and over 2,500 serovars. E. coli, on the other hand, is a single species.
And what about their disease-causing potential?
So while some E. coli strains are harmless commensals, others cause a range of infections like urinary tract infections and gastroenteritis. Salmonella, on the other hand, is generally considered a pathogen. Most Salmonella serovars can cause disease, whether it's self-limiting gastroenteritis or more serious systemic infections like typhoid fever.
Excellent. Second question. A patient presents with fever, diarrhea, and abdominal pain after returning from a trip to Southeast Asia. What laboratory tests would you order to confirm or rule out typhoid fever?
Given the patient's symptoms and travel history, typhoid fever is definitely high on the list, so blood cultures are essential. Since Salmonella typhi circulates in the bloodstream, stool cultures would also be informative, even though they might not be positive in the early stages of typhoid fever.
And would you also consider the Weedle test in this case?
The Weedle test, which detects antibodies against Salmonella typhi, can be helpful, but we need to interpret the results carefully due to potential cross-reactivity with other Salmonella serovars.
Okay, question number 3. Explain how those sneaky Salmonella pathogenicity islands, SPI1 and SPI2, contribute to the infection process.
So imagine SPI1 as a toolkit for invasion. It encodes a type 3 secretion system, essentially a molecular syringe that injects proteins directly into host cells, tricking them into engulfing the bacteria.
And what about SPI2?
So SPI2 comes into play once Salmonella is inside a macrophage. It encodes another type 3 secretion system that helps the bacteria survive and replicate within the macrophage, turning it into a Trojan horse for further spread.
It's amazing how these tiny bacteria have developed such sophisticated strategies. Okay, question 4. What key factors should we consider when choosing an appropriate antibiotic for treating a Salmonella infection?
We need to know the specific Salmonella serovar involved, the severity of the infection, and the local antibiotic resistance patterns. We also need to consider the patient's individual characteristics, such as their age, underlying health conditions, allergies, and potential drug interactions. It's a complex decision-making process.
Last question. What's the role of public health, measures, food safety practices, and vaccination in preventing Salmonella outbreaks?
Preventing Salmonella outbreaks requires a multi-pronged approach. Public health surveillance helps track cases and implement interventions. Individual responsibility, including practicing good food safety habits like proper hand washing and cooking, is crucial. And for typhoid fever, vaccination can be a powerful tool for protecting individuals and communities.
And that wraps up our Salmonella quiz.
Yeah.
How do you think our listeners did?
I think they aced it, but even if they missed a few questions, I hope they walked away with a deeper appreciation for this fascinating and formidable bacterium.
Me too, to all our listeners. Thanks for joining us on this deep dive into the world of Salmonella. We hope you learned something new and feel inspired to apply this knowledge in your practice. Until next time, stay curious and keep exploring the microbial world.
And don't forget to wash your hands.